Ever wondered why ADHD in women often goes unnoticed? Feeling constantly overwhelmed but can't pinpoint why? You're not alone. Today, we're going to take a deep dive into how ADHD uniquely affects women. Stick around to the end for an eye-opening ADHD in women quiz and practical next steps that could change your life. Hi, I'm Liz, mental health professional. Let's dive straight into a topic that's incredibly close to my heart, ADHD in women. ADHD, or attention deficit hyperactivity disorder, often goes unrecognised in women. Women with ADHD often experience symptoms differently than men. While men typically show more hyperactive impulse type symptoms, women tend to exhibit predominantly inattentive symptoms. This difference is crucial to understand, as it's often one of the main reasons why ADHD in women is often overlooked or misdiagnosed. So let's break this down further. Hyperactive impulse symptoms in men are more visible, external behaviours. We might see fidgeting, inability to sit still, talking excessively, interrupting others, and risk-taking behaviours as well. These symptoms often lead to disruptive behaviour in school, which makes it easier to identify in childhood. For women and girls, inattentive symptoms can be more internal, less noticeable to others. So we might see difficulty concentrating and staying focused, forgetfulness in daily activities, trouble organising tasks and managing time. We can be easily distracted by unrelated thoughts or other stimuli. These symptoms can be mistaken sometimes for laziness, lack of motivation, or other conditions. The predominantly inattentive presentation of ADHD in women can manifest in various ways. A woman might appear to be daydreaming or spacey during conversations. She might struggle to keep up with household chores or work responsibilities. There could be a pattern of starting projects but rarely finishing them. And she might frequently lose important items like keys or phones. There could be a tendency also to hyperfocus on interesting tasks while neglecting other responsibilities. So this difference in symptom presentation can lead to several issues, often misdiagnosis. So the inattentive symptoms can be misdiagnosed as anxiety, depression, even bipolar disorder. This is because the internal struggle and constant overwhelm can lead to mood issues that mimic these types of conditions. Delayed diagnosis, because these symptoms are less disruptive in childhood. Teachers don't notice them as much. Many women don't get diagnosed until adulthood. It's difficult for women to receive a proper diagnosis, but it's common in their late 30s, early 40s, after they've struggled for decades. Without a proper diagnosis, many women internalise their struggles. This can lead to low self-esteem, chronic stress, and a sense of underachievement. Masking is another common symptom for women, because women with ADHD become so competent at masking their symptoms, develop coping mechanisms that hide their struggles from others. This can make it even harder to recognise and diagnose ADHD. This can all affect ADHD symptoms, adding another layer of complexity to a diagnosis and treatment. It's really important to note that these differences are generalisations. Individual experiences may vary. Some women may exhibit more hyperactive symptoms. Some men may be predominantly inattentive. Understanding these typical differences can help more women to recognise their symptoms and seek proper diagnosis and treatment, potentially years earlier than is currently common. If you're finding this information helpful, please give this video a thumbs up and leave a comment below. I'd love to hear about your experiences with ADHD or any tips you have for managing it. Don't forget to subscribe for more content like this. We'll move on to looking at different ways that presentation might be mistaken for other conditions. So we might have a woman who is a chatty daydreamer. Women with ADHD might appear talkative and sociable, but internally their minds are racing from one thought to another. They might struggle to follow conversations or remember important details. We might have a woman who's a perfectionist, procrastinator. Many women with ADHD set impossibly high standards for themselves and then procrastinate due to fear of failure and ADHD. This can lead to a cycle of stress and self-doubt. We also have the emotional roller coaster. ADHD can cause intense emotions and difficulty regulating them. Women might experience frequent mood swings, anxiety, feelings of overwhelm. We might have a woman chronic multitasker. In an attempt to manage their symptoms, many women with ADHD become expert multitaskers. However, this often leads to burnout and incomplete projects. The insomniac overthinking woman might have racing thoughts and difficulty shutting off the brain, which can lead to sleep issues, which in turn can exacerbate other ADHD symptoms. I have ADHD and I started using planners and reminder apps to help me keep track of tasks and appointments. I set multiple alarms, I did mindfulness and meditation regularly, and it helped me become more aware of my thoughts and actions. I often do body doubling, working alongside somebody else virtually as well, which helps me to stay focused on tasks that I found challenging or I was procrastinating about. If a task takes less than a couple of minutes, I do it immediately instead of putting it off. And I learned to use my hyperfocus, scheduling creative or challenging tasks during times when I felt really focused. The last thing I'd say about ADHD in women is the importance of self-acceptance. One of the most important lessons I learned was to accept myself and my ADHD. It's not just a disorder, it's a different way of experiencing and interacting with the world. Embracing my many differences allowed me to find unique strengths and talents that I might have overlooked. So, before you go, here are 5 questions to help you reflect on whether you might have ADHD. These questions are based on ADHD screening tools from ADHD UK. You could also try the NHS website if you're in the UK, and American sites are also down in the link below. So, 5 questions. Do you often find yourself struggling to meet deadlines or complete tasks at home or work? Do you frequently experience feelings of overwhelm or anxiety, even with everyday responsibilities? Have you noticed a pattern of forgetting important appointments or losing personal items like keys or phone? Do you often feel emotionally unstable or maybe have mood swings that seem hard to control? Do you experience difficulty maintaining focus during a conversation or when you're trying to listen to others? If you find yourself answering yes to some of these questions, it might be worth exploring further. You can find the full screening tool in the video description below. Living with ADHD as a woman can be challenging, but with the right strategies and mindset, it's entirely possible to live a fulfilling and successful life. I hope my story and tips inspire you to embrace your unique brain wiring and turn yourself into an ADHD super warrior.